Hello everybody, thank you Swati, and we have with us Dr. Hema Burandare. Welcome doctor.
Thank you Ujwala and thank you Swati for kind introduction, and thanks to Mere Vitabiotics for having me here on this important day of birth defects.
Okay, so let's start at the very basics. What are the birth defects and how common are they?
Birth defects are very common. About 4% of babies born are having various kinds of birth defects which may not be seen outside, but they can still be structural and metabolic disorders. And then you will come to know only when baby is born or as baby is growing, or some may be just obvious at birth. And do you know all these are because of our genetic structure, because majority of them are genetic, some are of non-genetic origin also, but those genetic are mainly of this chromosomal. As you can see in this picture, what are chromosomes? So anything less or more in chromosome, or a single gene disorder, you can see that string of DNA which is either coming out of the cell or a part of the chromosome, or the chromosome is made because of this compact DNA gene. So any base which you see there, base pair, you can see there A, T, G, C, anything is missing or it is changed. So new addition or maybe deletion can lead to a single gene disorder, and these single gene disorders are about 4,000 which we can detect. Even though 23,000 genes are there, still we are having tests for these 4,000 which are functional genes which we detect, and then some are multifactorial. If you want to know the example of this, chromosome is very common. Down syndrome, what we see, like we have 23 pairs of chromosome, that is 46. One extra number 20, that is the most common. 1 in 750 births are because of presence of extra chromosome, and that is mainly 21. Then this can be detected by various ultrasound markers. Detected in the sense, this gives you an indication that there could be a possibility of extra 21. So ultrasound markers, some serum tests are there, or there is a history of a previously abnormal child. But the important part is everybody is worried about well-being of the child as well as will it happen again. So that time parental karyotype is also necessary. The test of chromosomes is called as karyotype. As you can see in that picture, the first baby is of Down syndrome, and then baby has got extra chromosome 21 placed in a different form. Depending on the position, the recurrence will depend what the parent is carrying. If it is a translocation, it can vary from 1 to 100%. In single gene disorders, again there are multiple disorders known, but the most common what we see in our country is thalassemia. Now thalassemia is a disorder where simple blood test, if your hemoglobin is persistently low, not responding to the medicines which you take, then you suspect that it could be a thalassemia. At the first go only, if it is not responding, immediately you should get red cell electrophoresis done and find out whether you are a carrier of thalassemia. We have got 10,000 babies born in our country. Worldwide also there are about 300 mutations. So any that ATGC I told you, any change in mutation in thalassemia, it is a HBB gene.
Okay.
So any mutation 25-30 may be common to India, maybe other countries it is different, but we do entire gene sequencing, and whatever the mutation, then you can find out if baby has it in pregnancy. So these are single gene disorders. Imagine two carriers marrying. So how much it is likely to get spread if you are not cautious about your thalassemia screen. In addition to that, and another thing is that then you will ask me, carrier screening means what? Everybody should screen only when hemoglobin is low. It is not necessary to wait. You can just do simple blood screen at school age, you can do it at college age, or sometimes before when your health checkup happens. So that time if you find that hemoglobin is low, so we can, I think it's very important. If you have got examples of Cyprus and Sardinia, we had same number of people affected, children affected with thalassemia, and they started screening program, and now not a single thalassemic, to best of my knowledge, is not born, but carriers may be there because they are using carrier screening testing compulsory for each and every individual. Then in addition to that, there are, it's not that if you get thalassemia it is end of it. You have treatments now, but they are complicated, like stem cell therapy, very expensive, plus child's life is dependent only on the blood transfusion. And above that is multifactorial. Again, I would say next to the multifactorial means defects in cardiac defects, defects in spinal cord, so neural tube defects, cardiac defects, hearing deficiency, So these are the conditions, cleft lip palate. So these are the conditions which are commonly called as birth defects, which are mainly related to your multifactorial, having multifactorial index. It may be it may be gene and interaction with the environment. It can be purely environmental, or it can be because of infection. It can be because of rubella, or it can happen also because of the deficiency. The most important is deficiency of folic acid and micronutrients.
Okay.
And today there are tablets available which can be taken in periconceptional life. When you talk about these disorders, then naturally you want it to prevent, then we say that periconceptional period only one should start taking the treatment.
So the couple should come when they plan the baby, not after conception.
Yes, because the first 10 to 11 weeks of pregnancy are extremely important as far as development of the child is concerned. So embryo formation, organ formation is finished. So if you start it late, then by the time the organ is already formed, then it just grows in size or some function. So that you have lost the valuable period, and then you cannot paste it inside that if there is a defect or correct it. So it's very important that if you take this preventive aspect, it's just not enough to have good food. Of course, you must have it in pregnancy or periconceptional period. But if that good food, if you are going to eat, the bioavailability of that is only 50%. So supplement, and it's proven worldwide that prevention of neurological defects is very much under control if you are going to have with the folic acid and the supplements of micronutrients.
And maternal health issues and infections also.
Yes, like rubella. Another important thing is that it's not only this kind of infection, but you might have a disease like epilepsy. So if you are having a disorder, or maybe diabetic mother, so maybe in epilepsy the drug also can cause a problem, whatever medication you take, or it may be because of the fits which you get. Same diabetic, we know, everybody knows that diabetes, maternal diabetes is one of the important cause of birth defects. You also asked me about the, I mentioned about the carriers, and then consanguinity is another important aspect. Because if there is a consanguineous marriage, every individual has abnormal genes, about 4 to 8 abnormal genes. It's a matter of chance that you might marry a person who has got the same gene which you wouldn't know unless you get a child with birth defect. But in consanguineous marriage, you share the genes in the family, and therefore possibility of getting it duplicated and same abnormal gene is very high. So I think couple who are having consanguineous marriage must get them screened before, and then if there is anything, you can do prenatal diagnosis.
Okay. And there are quite a few tests nowadays we have.
Very much, as you can see in this slide today, ultrasound is so powerful that you can see the birth defects to the minutest, but sometimes it can also be missed depending on the position of the child, or maternal serum screening, or amniotic fluid studies, or chorioangular, where you directly look at baby's chromosomes, or you can identify the genes depending on what problem you have to look for.
Okay. So we can diagnose, confirm if the baby has any condition. But if we miss it at that stage and the baby gets born, then is there any treatment, and what is the recurrence risk?
Okay. Now in recessive disorder it is 25%, in chromosomal if it is a dominant disorder it can be 50%, so only one single parent can be a carrier, which you can screen by various tests as I said before, or depending on the family history. But also it is very important that if these, like you said, if it is missed, then when baby is born, baby may look healthy, but just a simple heel prick and 2 drops of blood, like newborn, that is called as newborn screening. Lot of disorders, genetic disorders can be screened by newborn screening. And then if the treatment is given, management, because whatever is deficient, if it is supplemented, you can avoid mental subnormality depending on what kind of disorder it is, metabolic disorder. Also hearing, child cannot tell you that I cannot hear, and if you cannot hear properly, you cannot speak. So again there is lot of loss if it is not, period is lost before child learns first words and you come to know that baby is deaf. Similarly with cardiac anomalies, some can be still missed on ultrasound. So you have got pulse oximetry, you have got hearing deficiency tests. So lot of tests are available on post-birth. Of course chromosomal or thalassemia also sometimes you can detect after birth, but then the child is born. But in newborn category which I told you, in that definitely it is possible to avoid the seriousness of the disorder.
Okay, okay. And this blood test that you are talking about, if that sample can be couriered.
Yes, that's very important point you said. That it is possible, it's not necessary you have to have a lab in your vicinity, because these samples like blood you can come, fetal blood can, a baby's blood can come on a filter paper, just few drops. And other bloods or all samples can be couriered, mostly at room temperature, but sometimes you can also courier it, in cold pack if required. But it's very easy, so anybody in the country, anywhere in the world, you can access a laboratory and you can get it tested.
Okay, okay. The other day you were telling me about cancer genetics and a story of Angelina Jolie, that Hollywood actress.
Yes. Now when we are talking about so many screening methods, one screening method is called as predictive testing. Today, cancer has got specially familial cancer, or other cancer is genetic, but there are various familial cancers in which you can do the test. Angelina had her family history of breast and ovarian cancer. She got herself screened, found to be high risk. She took the management, whatever was mentioned to her, but she started spreading the word that yes, if there is a cancer, familial cancer, screen it, and before you get the symptoms. So we have got for Huntington's disease. So today we have got predictive testing also. So it's possible now.
Okay. And as far as the genetic tests are concerned, the counseling part is most important, the pre-test and post-test.
Yes.
And you are in active practice for almost more than half a century now.
Absolutely.
So your role must have changed. What was in the beginning now and what is now? So how is it changed?
See, now I think I have lived in golden era of genetics. We were doing only chromosomes. People used to laugh when I started my clinic. What the disorder which doesn't have treatment, what is the point in testing it? But slowly that they didn't understand the importance of giving counseling, that recurrence risk, that first child is down because parents are carriers, second child is down, or first thalassemic, second thalassemic. So that kind of thing requires first pre-test counseling to explain to the couple also that yes, now you have got the child with defect, but next can be prevented. So that is pre-test counseling. Again, genetics is not taught in the medical school as a regular subject as yet. So it is very likely that you can miss out. Doctor may not be aware. More than 40% you can say blindness, deafness have got genetic as a cause, and it's possible for us to detect that and find out the carrier status. And then once you know that yes, you can find out, then you can guide the patient accordingly. And then the results which come, again they are not able to interpret. So you give a counseling, post-test counseling to the patient as well as a letter to the doctor so that they understand and guide them. In genetics, patient comes to you only once.
Right.
Once the results are there, because these are not, they can run in the family. So once the result is there, then they are not going to come back. They know that it cannot be corrected, or management is done by their consultant.
You had told me about a small girl, school child, you had met at a camp. She had some heart defect, I think.
Yes, very rarely people have thought of having a camps on genetics. And Mayor Vitabiotics, we had 2 camps on birth defect prevention, one in Sindhudurg, one is Aurangabad. So it was basically, it is a teamwork. Of course, we require a physician, means pediatric physician or a pediatric cardiologist, or whatever the area of specialty you are handling in that particular camp. So this was a camp for congenital heart defect. That was at Redcar Hospital. It was for heart defect, and father came with the daughter saying that I have come to you because my daughter has been prevented from attending the school because of lack of discipline. She is not attending any sports, not doing any PT classes. She is lazy. She sits at one place only. And then I came to this camp and I am benefited that I got to know child has got a hole in the heart. But still she is doing her regular activities. So I said, please do not. I stopped him then and there and I said, don't do this mistake, first get it corrected, because don't think about playing sports or taking part in the activities, but tomorrow she is going to become a mother, and then if you don't correct it now, then she is going to bear that load of circulation, fetal circulation as well, and it might be life threatening for her. So he was very happy that we also gave that cover.
It must be the most satisfying moment of your life.
Yes, Ujjwala, it is so amazing that I have come from field of anatomy, embryology, genetics, and from cadaveric dissection to genomic dissection.
And there was one boy whose siblings had fragile legs. That was another
You are
story
not
that-
only memory strong, but you have learned a lot of genetics by writing these books with me. So this boy had 3 siblings having mental abnormality, that is Fragile X, you said. But what happened was he wanted to marry, so a social worker brought him. Just
Okay.
imagine what role social workers also have. In the camps also many social workers have brought the patients. So when the social worker brought, he said he wants to marry and he wants to know the risk to his progeny.
Okay.
So anywhere you want to find out, you have to do carrier screening. Though Fragile X is transmitted by mother, that means from a female. So we knew that, but he was in love. He got a girl who knew that he had such siblings and they wanted to marry. So of course he was not a carrier definitely, but we did carrier screening for both of them, general carrier screening, and even specially he wanted us to do carrier screening for Fragile X for the girl. Because knowing that his mother turned out to be a carrier and everything was okay, but I told him that's not it. Sometimes we go a step ahead and we almost go do marriage counseling. So what we do is I told him that, see, now you told me once in your last visit you don't want to leave your brothers and sisters at home or in a special care school or home, and you want to take her. Is she ready for that? You have done all the medical part of it, but this part, like, you have to explain to her, otherwise in spite of having everything normal, your life will be miserable.
So you try to spread awareness at every possible chance you get. Okay. So you have authored many books also, and your latest one, Shoots and Roots, will be available shortly. Now, what do you think is the need for yet another book?
Okay, now let me go back first to the books which I have written. They are mainly for physicians, and I thought an Indian writing books on genetics is mainly for, they give their own experiences also in that, types of patients we deal with, what problems we can have, and learn little bit of genetics from people whom they can just call and ask about their queries regarding the disorders. It is I think it was very satisfying experience there. Then I thought, but still I see that many doctors, when they are referring patients, they will come just by reading something on the Google and they will say, okay, we want to know more about it. I said, let me have a book so that the word will spread, and both of us have done this Vaush and Vaush in Marathi, and because of that thumping response to that, our colleagues, even professional and not in the medical profession, said you must write it in English, and therefore this is the birth of this another book that is again
And now it can get translated to other languages also.
Yes, let's hope so. I think everybody loves to learn in their own language and remember it the best.
And Granthali and Mayor Vitabiotics have supported us wholeheartedly.
Granthali has taken initiative for such a rare subject. I mean, you talk about cancer, anybody will buy a book. You talk about diabetes, anybody will buy a book. Okay, some information. But what about genes? We don't have anything in the family. Why should, these are individually rare but collectively more, these disorders. So when they read, they will come forward and we'll be able to, it's a movement towards prevention of birth defects. So the book is for physicians as well as non-physicians. And this is what ANPA has understood by Granthali, and now Mayor Vitabiotics has taken initiative to help us in, going ahead with this book.
Okay. So awareness is the key.
Absolutely.
Okay. So I think almost all medical condition, the buck stops at genetics.
Very. There are specialties. Now all specialties have got nearly 1% or to 100% cause of that defect as genetic. So if we don't identify, it gets transmitted in next generation. So what we want to do is like make them aware that yes, whatever disorders, whether it is kidney, adult polycystic kidney disease, these are all genetic conditions and it can come anytime in life. It is not necessary that it should be there at birth.
But this science is comparatively new and you have witnessed and participated in the golden era, you just said. So do you have any specific message for us at the end?
Okay, at the end of I'll say, see, birth defects is not a surprise. Ask your doctors how to prevent it.
Okay, thank you, doctor. That's it.